Hi, my name is Christina Howard. I'm faculty with the Physical Therapist Assistant Program at Lane Community College, and I've chosen four examples of OER that we use in our program, which is a mix of hybrid learning, face-to-face, and online instruction. The first example is an online tutorial resource that we use. It's by the CDC, and this is our lecture content for hand hygiene and infection control. It's the pre-lab material that students go through to prepare to come to laboratory, where they actually practice appropriate hand washing technique. It goes through the content, so instead of a textbook, we use this to cover content for standard precautions, as well as in the lecture, and then the students get a chance to get prompted with some questions, get an opportunity to provide some feedback, and then at the end of the tutorial, here's an example, they have to take a self-test and submit the results of that self-test to us through Moodle. So they do a screenshot of the final page with their score, and they upload that into Moodle to show that they're ready to practice effective hand washing in lab. So that's one example of OER that we use that's offered by the CDC. Another example are when they take their orthopedics course. It may have been a while since they took anatomy, so we link through Moodle to some open educational resources offered through Maricopa College, and this is an instructor there who has created a nice tutorial for students to review muscles of the upper arm, so they can go through and highlight different muscle areas and get some feedback about what's going on anatomically. That's a nice resource for students who just need to review, and we can direct them to those resources for review versus them finding it. Another example that we use is YouTube. Our students who are preparing for their practical exam and want to get some feedback from their peers on their professional presence and skills will create videos in our lab.
Today how to set up the parameters and use the mechanical traction machine.
Upload them to YouTube.
Have our patient lay on the
I
table.
keep the link private and send it out to students through Moodle.
Make sure that the patient is laying so that the joint we want
and
to
they get an
contract
opportunity
is directly
to
above
observe
the part of the table that separates.
Techniques
give our
and have
patient
repeat practice without having to be in the lab if needed.
We're going to let our patient know.
That's another example. And then lastly, we do use SoftChalk to deliver our interactive lecture material in our online courses. Here's a brief example of vital sign assessment. So in addition to content here, the students have an opportunity to get some feedback through self-checks. So we have self-checks embedded in the exam where they can check their answer and get some immediate feedback. It's low stakes, it's not scored, so they can go back as many times as they want and then be prepared for their exam with hopefully some focused on their studies of where they should spend their attention. So those are three samples of vital sign assessment interactive lecture through SoftChalk, student-generated videos for repeat practice of lab techniques in YouTube, and then a pre-generated tutorial by the CDC on hand hygiene and infection control for healthcare providers.